You're watching CT22 with Eric Parker, sponsored by Hartford Healthcare.
Welcome back. It's hard to imagine how defeated Connecticut's nurses must have felt when they learned a new and more virulent COVID variant had arrived here, extending the pandemic yet again. Here to talk about what they've been dealing with and what's being done to help these helpers is Dr. Stephanie Paulmeno, a longtime nurse who's past president of the Connecticut Nurses Association and a current board member with that organization. Dr. Paulmeno, thank you so much for being with us here on CT22. What are you hearing from members of the association, from these nurses who are on the front lines? How's it going?
Well, it's been exceedingly tough, and thank you for having me. It's been exceedingly tough for nurses. And when you talk about nurses, we're working in so many different areas, and all of us have our own unique components of difficulty. I just heard your prior section about the school nurses. I'm a nurse in public health, but nurses on the front line, nurses in long-term care, nurses working in the med-surg units, they're all struggling. It's been so exceedingly difficult and demoralizing to be going around and around and around with the same issues and not seemingly getting ahead on it. Our numbers keep rising, our deaths are rising, our positivity rates are rising. We continue to have people who are unvaccinated, and it burdens our system tremendously. We're running out of beds again at some point here. And the stress has led to increased suicide amongst nurses, increased substance abuse. Nurses have a lot of PTSD. Many people are going into therapy. Marriages have broken up because of the stress. In the healthcare field, we're literally working around the clock. For me as a public health nurse doing contact tracing, it's a 7-day-a-week job, and I'm often going from 8 in the morning till 10 or 11 at night. Around 9:30, I switch to text messaging because you can't be calling people that late. But all of us are struggling with the extreme numbers of people who are so much in need and who are pained and troubled and distressed. And we are too. There's incivility in the workplace. There's incivility in the community. Nurses who have been the most beloved people through all the Gallup polls since they hit the Gallup poll registers, people are now being not so kind. And it's very distressing.
I want to talk to you more about some of the mental health stuff you mentioned, and we will in just a moment. But we all feel it, right? Everybody in the community feels like, oh, here we go again. We got another wave coming. But when it's your job to deal with it and to deal with patients and to be in high-risk settings, does maybe that UG hit a little harder because it's not just personal? It's not just when you go to the grocery store. It's not just when you go to the restaurant. It's all the time?
It is all the time. And as a nurse, and I'm sure almost every nurse will say the same thing, even when you're not working, you're working because your neighbors come to you, your family members come to you, total strangers come to me. I take part a lot in a program that many of you might know, the Next Door. I kind of use it as a blog to get our public health messages. And I've had people reach out to me on that who are very troubled. I started a nurses group on that so that we could monitor what was coming into the I guess it's a blog, in terms of what's valid information, what's not valid information. And it's so distressing.
Dr. Paulmeno, I know another thing that you are doing is some continuing ed for nurses, talking about things like suicide risk assessments and mental health counseling. We only have about 30 seconds left, but tell me about that. That's important work.
Yes, it's the first mandatory nursing education program that Connecticut nurses have ever had. And we've been asked to address suicide prevention and assessment, PTSD, substance abuse, ongoing grief or continuous grief, post-traumatic stress disorder, depression and anxiety. So we have a 2-part series coming up on January 13th and on January 27th that can be accessed through the Connecticut Nursing Association website, ctnurses.org.
Well, like you said, nurses always high in those polls of people everybody likes, and certainly that is the way it should be. And it's telling that for the first time that mental health piece is coming in, but certainly a worthwhile cause, and hopefully a lot of nurses will look into that. Dr. Stephanie Paulmeno, thank you so much for being with us here on CT22.
It's my pleasure. Thank you.
We turn now from nurses to teachers. When they left on winter break, Omicron was just beginning to take hold in Connecticut. Now it's here and they're back in school. So what's it been like? Kate Diaz is a high school math teacher in Manchester and the current president of the Connecticut Education Association. Kate, thank you so much for being with us. So I just asked the question about nurses. I'll ask it about teachers. How's it going?
I think it's been a rough go back. I mean, truthfully, we thought we were headed back with masks and tests, and that hasn't been the case. Largely across the state, teachers are still waiting for their N95 masks. They're slowly rolling out. But we did start the week with only about 40% of our teachers having access to those and less than 30% having access to home test kits. So that was particularly stressful when we had anticipated those things being in place for us. In addition, we returned with high absenteeism. Our colleagues had come down with COVID, and we were really concerned about what the spread would look like when we really hadn't had time to address mitigation strategies. So teachers, being what they are, returned back to the classrooms in full force on Monday and Tuesday, and trying really to figure out what can we do to protect ourselves and protect our students. And so we started really having conversations about how do we turn some of our large meetings into virtual, where are our places to advocate for one or each other, to figure out what we can get to really turn this corner for ourselves.
We mentioned in the earlier segment with the Commissioner of Public Health that anecdotally a lot of people have said they just seem to know more people who have tested positive. Has it felt that way inside the schools? What are you hearing from the CEA members that you talk to? Does it feel like they've hit a little bit of a turning point where there's just so many cases?
Yeah, absolutely. We've seen a much higher rate of teachers in particular who have COVID. I know over the break I was monitoring that and I started to see a lot of people, and many, as we know, who are vaccinated and still came down with COVID and tested positive. And so we're really watching those numbers, recognizing that staff shortages have tremendous impact, not just on our own working conditions, but our students' learning conditions. When we start getting into a space where we have to combine classes or, try and put all the kids in the cafeteria, we really get into a space where what are we doing and why are we doing it? And so we've really started to push back and say, are there other choices? What are the flexibilities that our districts have that we can maybe put into place? Or are there things we should be asking the governor's office for? For example, there's been a greater interest in having short-term remote options available now that teachers and everyone shouldn't be coming to school with any symptoms at all. There's been certainly times where I went to school with a sore throat or a cough. Now I wouldn't be able to do that, but could I teach remotely for the short term? Absolutely. So I really think we're asking for some opportunities to weigh out the flexibilities and the options that we could deploy to make getting through this Omicron wave a little bit more bearable.
And actually in the classroom, you mentioned at the beginning, masks is the biggest priority. Is that what you're hearing from members? You just want access to high quality masks in your hands?
Absolutely. I think we have prioritized that fairly high, recognizing that the transmissibility of this particular variant is so aggressive. And the higher quality mask we have, the better off we are. In particular, I always have great sympathy for my elementary friends where the vaccination rate among students is so low. And so their opportunity to be exposed is much greater. So having those masks is a layer of security. It's a layer of protection that really is essential to making us feel like every day we're coming in and people are concerned for our welfare.
Just a couple seconds left. Has it just been tough with so many people? I know even bus drivers, who aren't your members, but there's so many people who aren't in school. Has that been tough for you?
Absolutely. Every person that's not present, somebody else is picking up the task. So we have to keep in mind that schools are very tight and well-oiled machines. At the end of the day, one person missing requires other people to step in and do those roles. Bus driver out means buses are delayed and somebody is taking care of those children. So we have to remember that, these things really do matter.
All right, Kate Diaz, CEA president and Manchester High School math teacher. We'll let you get back to class. Thank you so much, Kate, for being there. We look forward to having you back on CT22 again.